most important factors a patient should consider when they are considering plastic surgery? There must be surgical and non surgical options available in plastic surgery. However, there is a word surgery connected, attached to plastic surgery. Are there any non surgical options also available, and which ones should a person decide as a patient?
The commonest is, of course, as I said, the scar has to disappear. And why can't you make the scars disappear? So obviously, that you're not really up to it, because Doctor So and So or social media influencer so and so told me that scar surgery is scarless. So why can't you make the scars disappear? So that's the first.
होते हैं, जैसे हम ब्लड की मैचिंग करते हैं, तो एक तो ब्लड हमारा लाइफ पर्सन से ही आता है। ये स्किन ग्राफ्ट्स कहाँ से आते हैं और उसको किस तरीके से मैच करते हैं? डू दे मैच एनीबडी एंड व्हाट इज, वुड यू लाइक टू टेल अस अबाउट इट? Namaskar. Hi, I'm Dr. Major Namita and welcome to the Army Doctor. If you're looking for authentic medical information, then you're at the right place. Today on the show, we have Dr. Colonel Vijay Langar. He's a gold medalist in plastic surgery and as an expert in post weight loss body contouring. He will be sharing with us his experiences both in the army and civil. He'll be talking about various cases. He will also share with us the reconstructive and the cosmetic procedures for in general and also for the cancer patients. We'll also talk about the skin banks, we'll talk about the burn cases and much more. So stay tuned, and if you're liking the show, you've watched our other videos, don't forget to like, share and subscribe. Keep watching. Let's welcome Dr. Colonel Vijay Langar. Hello and welcome, Dr. Colonel Vijay Langar. I am so glad to have you on the show today. He's a renowned plastic surgeon. Not just that, he's an ex-Indian Army doctor. Not just that, he's also from my alma mater, FMC. Welcome, Dr. Vijay Langar.
Thanks so much, Namita. Ex-major yourself and such an accomplished doctor yourself. But thanks very much for this warm welcome, and yeah, it really warms me up to be on your show.
Thank you so much,
Thank
sir.
you very much.
Sir, we were really looking forward. We have so many questions, so many people were expecting you here. So let's start with a very simple, basic question as to what inspired you to become a plastic surgeon. Would you tell us about your journey to becoming a doctor, then a plastic surgeon? How did it all go?
Great. Yeah. Thanks very much. So, oh, this seems like a couple of lifetimes away. But 1985, I finished my 12th standard examinations and took my exams for medical entrance. And I was so excited to be part of the to get entrance into Armed Forces Medical College, and my dream was to join the Indian Army, to serve the nation, to spread smiles all around, and so that was a dream come true. And we joined in 1985, finished off MBBS, then did my RMO, that's the Regimental Medical Officer tenure, and that was exciting and adventurous. There was not much to do, but there were a lot of accidents and gunshot wounds and so on. I was posted at the border, but I always knew that I wanted to become a surgeon. I wasn't sure about what I wanted to do after that, but definitely a surgeon. The challenge to treat the patient, any patient, surgically was amazing. A huge change used to come across and engulf me, so to say, when I used to when I used to go to the operation theater. So I knew definitely I wanted to become a general surgeon. After I became a general surgeon, so as a plastic surgeon, or then you have to super specialize. So that means there are 4.5 years of medical training plus 1 year of internship, then 3 years of general surgical residency, and then a super specialty residency also of 3 years. So it's almost a lifetime. So many years of learning and training. So, as a general surgeon, I used to love the challenge of treating serving soldiers and their families and so on, and in the emergency setting, etc. But I found a calling in reconstructive surgery, such as a very common injury used to be hand injuries and so on, and I used to treat these patients with whatever I had learned and continue to improve. And so, therefore, I knew that I think, at that time, I knew I was destined to be a plastic surgeon. So I joined Department of Plastic Surgery at AFMC, again back to my alma mater, in 2002, and then for the first year was quite rough. The residency, actually, I was on the verge of um, leaving plastic surgery because I loved being the king of the whole human body, so to say. So I could treat so many aspects of the human body, being a general surgeon. But then when the residency got over, and I knew then that I was born and destined to be a plastic surgeon, because I feel in each case, in each patient that I treat, um, I, I, I believe that we make a difference, and make the world a better place.
So true, sir. It is really interesting that you happen to mention only a gold medalist can find a hand surgery interesting, because the hand surgery is like so complex, the anatomy. It's absolutely amazing. Now, I want you to tell the audience as to what does a plastic surgeon do? क्या क्या करता है वो?
Right. That's a very good question, because most of the people around us do not know what a plastic surgeon does, and they feel that it's only about cosmetic surgery. But far from it. Plastic surgery takes its origin, humble origin, in the Greek word called plastikos, and it means to mold, and it has nothing to do with the plastic that we know, which invades or pervades our society and the environment around us. That started in 1862, but plastic surgery started way back in ancient India. The father of ancient surgery and indeed plastic surgery, Sushruta, was the pioneer of plastic surgery back then, in before Christ. So there are two main arms of plastic surgery. One is reconstructive, and the other one is cosmetic surgery. Reconstructive is again part of what you said, hand injury, hand surgery, and so on. It's so complex. So in reconstructive surgery, there are a few subheads. The patient is has deformities, and they are looking for form and function, but mainly function. So they may be burnt children or adults, cancer survivors. Trauma reconstruction is a huge subset, where we have road traffic accidents or even gunshot wounds and so on, and they have to be, the dead tissue has to be knocked off by the plastic surgeon and then resurfaced in the form of own skin and thicker skin, which is what is called as a skin flap. Congenital deformities such as cleft lip and palate, craniosynostosis, where the baby's skulls fuse prematurely, and therefore they run the risk of mental retardation, and various other problems. Cosmetic surgery, on the other hand, is about patients who are looking good but want to look better.
Something that's more
The challenge
popular,
is,
something that people know
yeah,
about.
yes, but and they don't know much about the reconstructive aspects, because a peripheral nerve injury, such as a brachial plexus injury, is something where the nerves give function to the upper limb. That they will go to a neurosurgeon,
Okay.
whereas the neurosurgeons will usually take care of the head, the head trauma, as well as the cranial tumors and the spinal tumors and spinal trauma.
जी.
They don't deal with peripheral nerves. So we are the ones who deal with peripheral nerves, tendon, and so on. Yeah, and so the cosmetic, going back to cosmetic, the challenges in cosmetic surgery are diverse, much more different from the reconstructive subset,
जी.
because the patient walks in looking good, wanting to look better. Therefore, the pressure is that much more to make a perfect appearance, or a better version of the patient who comes in. And both these subsets are very exciting, and therefore, so it's plastic surgery is all about treating the skin and all the organs in the body covered by it, which means pretty much from head to toe, the whole body. So it is amazing. The challenges are amazing.
So, what, in spite of so many challenges, what is it that you find most rewarding? What keeps you going? Because the lengths of surgeries, few of them are like really, really long. What keeps you going?
Just the passion. I mean, the day, every day when I wake up, I feel that I'm excited to wake up. I think the day I feel, oh hell, another day. That'll be. I don't think that will dawn on me, because it always excites me to touch human lives, and make the world a much happier place. And we've had some extraordinary cases. I'll tell you as we go along. We'll talk about these cases which were really touching, moving, and life changing for the patients as well as for us as doctors and healers.
Great. What are the most important factors a patient should consider when they are considering plastic surgery?
Good question again. The patient, especially cosmetic surgery patient, should be in near normal health with realistic expectation. Now, the expectations are very important, because a lot of patients of mine feel will there be a scar, and the scar, of course, you're a senior plastic surgeon and experienced plastic surgeon, you will get rid of the scar. I have no problems. But that is exactly the problem. The scar, once we scar, we do not, the scars do not disappear, and that's a huge myth about which shrouds or enshrouds the field of plastic surgery. So it's the patient has to have good realistic expectations. For reconstructive subset, it is completely different. It is so I've had patients in the army coming with hands like this, and if I could stretch the hand only till here and not till here, even then he would he would have tears of joy in his eyes, and would touch my feet and go. I'm not making this melodramatic.
I've
The
seen patients
expectations
doing
will
that, so I know.
yeah, yeah, yeah. You and I have been there together. So the reconstructive subset is completely different from the cosmetic subset.
Um, so this was reconstructive and cosmetic. I want you to tell us that there must be surgical and non-surgical options available in plastic surgery. However, there is a word surgery connected, attached to plastic surgery. Are there any non-surgical options also available, and which ones should a person decide as a patient?
Yeah, well, that's yes, of course, the non-surgical options are available. In fact, in our country, the surgical volumes, the OPD volumes, as you know, are much more than the surgical volumes. This, which is completely different from the West. The surgical volumes generated there in the West are much more. So a lot of us do not want to go through, under the knife. So while if you lift this, the best contour will be available with a formal face and neck lift.
Okay.
But the other options are also available, such as fillers and thread lifts, and so on. So depends entirely on the patient. In my consultation, I just tell everything about whatever they want, the surgical as well as the non-surgical aspects, and then I ask them to choose. What they should choose is entirely up to them, especially in the in the cosmetic subset, because if they're okay with downtime but they want longevity, then that comes only with surgery.
Okay.
But there is a downtime about maybe various procedures have different downtimes, but 2 to 4 weeks is a rough median downtime for any a significant or major cosmetic surgery. uh, Compare that with non-operative options such as fillers, botox, thread lips, and small injections for fat dissolution, etc. They are just pretty much walk in and walk out procedures. So you don't really need too much of a downtime there. So, but the patient decides, and that unfortunately the non-operative option will have a much lesser longevity. So let's say Botox will last for only 4 to 6 months and will have to be repeated thereafter. Fillers will last for about 9 to 12 months, sometimes 18 months, and then again be repeated, and the same holds true for threads.
So true. Sir, you just mentioned the walk in procedures. Tell us about that walk in procedure that is around like 15-20 minutes and most satisfying to any patient. I mean, that is something that people have been really happy about कि मैं बस घुसा मैंने कराया and I'm out, no admission, nothing, कुछ भी मेरे को बाद में नहीं कराना पड़ा.
Yeah. So that again, surgical procedure usually always has a downtime of 15 minutes. In 15 minutes, we can probably do a scar revision. When I say scar revision, it's important for us to understand that I'm not saying scar removal. On my website, on my Instagram page, nowhere will you see me professing scar. We remove scars. We never can remove scars. We only reduce them and make them fade well. But that is one. And then the non-operative procedures are many, myriad. Botox and fillers. Fillers in particular, fillers and thread lifts will be cataclysmic because you can actually lift the cheek in 15-20 minutes,
Wow.
and the patient walks out
Okay.
and looks absolutely young
Amazing.
and
ठीक है सर. जैसे आपने अभी मेंशन किया स्कार रिमूवल नहीं होता, इट्स इज स्कार रिविजन. You must be coming across other misconceptions also that a
yes.
lot of patients must be coming to you with. So what are the common misconceptions about plastic surgery that you come across?
Yeah, good question once again. You got all the good questions coming. Yeah, so the biggest is the scars disappear. So there was a gentleman who said, I want the scar to disappear. So I said, it won't disappear, but I will reduce it. So he said, we are living in the 21st century. Why can't you make the scars disappear? I said, well, at least not now. Maybe 50 years, 100 years, whenever science reaches that level. So interestingly, I talk about intrauterine fetal surgery for cleft lip repair,
Wow.
which came in for a bit, and it could be done in the mid trimester or in the middle of the pregnancy. But then it was understood that the stakes are much higher.
जी.
You are running the mother is running a risk, the fetus is at a risk for general anesthesia and so on. That is the only time that we do not scar, and therefore when surgery or trauma occurs during that time, if it does, then there will be no scar. Otherwise, the moment we are born, we heal by scarring. The scars always remain for life, but they settle down by about 6 to 9 months, maybe a year or so, and they settle down and fade well. So those are the that's the misconception. Then scarless surgery. Now, if you do a surgery, there will be a set of scars,
जी.
which again will only fade, and they will always be there. So our work, our job is to hide those or camouflage those scars and allow them to fade well. And when the patient says, or a lot of internet and the media is abuzz with reports of scarless surgery, there is unfortunately no such thing as scarless surgery. Another misconception or myth is that more women come to us than men. While it is true to a large extent, but the number of men or males that are increasing for cosmetic surgery in particular
जी.
is really you have to see to believe it. The sort of cases that I get, or the referrals that I get for male cosmetic surgery is amazing.
Okay.
So that. Then liposuction or fat removal is a weight reducing surgery. That is the biggest myth going around. I
Okay.
want to remove 15 kgs. There were a few patients who said, I want you to do this procedure which will remove 15 kgs in 60 minutes. I said, I am not aware of such a procedure.
Okay.
However, cool sculpting and so on, you can freeze the fat, etc., etc. It can be done in 60 minutes, but the problem is longevity, and it keeps coming back. Even with a liposuction, the fat will come back if there is dietary indiscretion.
Right.
So if the patient continues to eat and not exercise and have high caloric foods for eating, then the fat will come back. But liposuction is all about body contouring and not about weight reduction.
Sir, since you've come to body contouring and weight reduction, जैसे कोई एक अच्छा सा कलाकार जो होता है एक सुंदर से पत्थर को तराश देता है एंड दैट इज़ समथिंग एवरीबडी इज़ वॉन्ट्स एन आर ग्लास फिगर, एवरीबडी इज़ लुकिंग एट दोज सेलिब्रिटीज़. उनको लगता है कि वाओ ये बॉडी कंटूरिंग हम करा लेते हैं. एंड
Yeah.
but and also you have you've got your fellowship in body contouring from US. I want you to talk about body contouring. What is it? What's the procedure? And किस तरीके के लोगों को करानी चाहिए, और what are the things that they should take care of before coming for body contouring?
Yeah, great. So again, two major tenets, two major rules. One, it's not a weight reduction surgery. The patient should be in near normal health and should have very realistic expectations. So if they whatever they want, they'll get, but it has to be a realistic expectation all the same. The fellowship that you kindly mentioned, it was a fantastic break that I had, and it was a clinical fellowship in body contouring following massive weight loss. So
जी.
that was after the bariatric surgery. So we don't do bariatric surgery. I mean, it's done laparoscopically, and you reduce the size of the stomach, or maybe even switch the intestines and make anastomosis, and so that the patient starts losing weight. Then they lose weight to the tune of 30 to 50 to maybe even 70 kgs. These are the guys who actually then sag. When they
Okay.
sag, then they cannot be treated with liposuction alone. Liposuction, you have to have a good skin tone, but their skin is all sagging. It's got a lot of stretch marks, and
जी.
so if you were to take out the fat, which is not much, it is mainly the skin fat envelope that has to be removed. So therefore, it is an excisional procedure, or a procedure where you have to cut out the extra skin. So if it is done circumferentially, those are very challenging surgeries. That's what is called as belt lipectomy, and I was trained in that, and among other things, and it was very rewarding. We actually operated. Since I had that temporary licensure, I was operating with my mentors, Dr. Al Ali and Dr. Al Tran. And so that was it was so the body contouring is more about a realistic expectation and actually body contouring and not weight reduction. When the patient says that I want to reduce weight, he or she is not looking for body contour, or he
Okay.
or she is not clear, and therefore the clarity has to be brought out by us in that consultation.
ओके ग्रेट एंड यू कम फ्रॉम अ मैजिकल वर्ल्ड ये मेडिसिन का एक मैजिकल वर्ल्ड है और आप होते हैं मैजिशियन है ना सो व्हाट आर द वियर्ड डिमांड्स दैट पेशेंट्स कम विद व्हेन दे आर एक्सपेक्टिंग सम सॉर्ट ऑफ मैजिक एंड यू हैव टू टेल देम नहीं भाई दिस इज नॉट it's not like this. What are those weird demands that you've come across in your overall
Yeah,
experience?
that's that's another good one. So every day I have a weird demand or two. The commonest is of course as I said, the scar has to disappear. And why can't you make the scars disappear? So obviously that you're not really up to it, because Doctor so and so or social media influencer so and so told me that scar surgery is scarless. So why can't you make the scars disappear? So that's the first and the commonest. Then photographs being pasted or put across to us of celebrities and Bollywood or Hollywood actors and actresses, um, not taking the harmonious view of the whole face, but saying, I want a nose like hers. Oh, that nose of hers sits well on her facial skeleton.
Okay.
It will not fit on your facial skeleton.
Okay.
But no, I need that nose. I need that nose. But sitting on that whole face, I think your nose should fit your face. So that's the problem. There was a lady who came in and she said, "Do you like my nose?" I said, "Yeah, you got a pleasing face with a good nose. I want this is my daughter. I want her nose to be exactly like mine." I said, and and that lady was the daughter was a major, so she would have had to give the consent for surgery. So I said, "What do you want, miss?" So she said, I don't want anything. It's my mother who wants me to get a rhinoplasty. So I said, this is not going to work. It's not going to work. You're putting your dream, or you're living your dream through your daughter. I mean, you say, I like this nose, and the two of us have to have the same nose. So, and now with increasing social media pressures and influences and so on, this is something new that we are getting. So, on the screen, it seems that the normal ears appear flattish,
Okay.
right? So now they're looking for making their ears like that,
All
bat
right.
like,
Okay.
which was used to be, it is a deformity which he correct. So bat wing or bat ear deformity is something that we correct by putting it right back against the skull, against the scalp,
Right.
and makes it look more beautiful.
G.
Now it's the other way around. Now these guys want their ears to look like that.
Okay. They wanted to show more.
They wanted to show more,
I
because they
think
feel
they're
that
known as
not.
gnome ears. I don't know. There was some sort of a fad that came up that it
Yeah,
should look like elves or gnomes, and
correct,
people put that those
correct.
extra things on their ears to look like some gnome or a elf ear.
Yeah, amazing.
Very interesting. And these are the weird demands. There must be some interesting cases that are really close to your heart, that you really relish or you remember, and you would like to share those interesting cases with us, sir.
Oh yeah. So from the army days, a lot of trauma reconstruction and cancer reconstruction and burns. We used to actually take pride in the army hospital. In fact, congratulations to the team in army hospital R&R, or research and referral, in New Delhi. They've recently, or yesterday was the day that the skin bank the first skin bank in armed forces, Indian armed forces, was sanctioned and what was
फैंटास्टिक,
inaugurated.
हाँ कितना
Yeah,
अमेजिंग है.
and it is amazing, and there are a few of them in our country, more so in the West. If we have had a lot of challenges with burn reconstruction and treating burns and so on, but we used to believe that we could get very good results and a fighting chance for survival if we cut out the dead tissue or burn tissue and replace it with your own skin graft. The thin skin, which part of the thigh skin or elsewhere, and cover that raw area, and would give that the body a great chance at survival, especially with patients with severe burns, such in the category of what 40, 50, 60, 70% burn wound area. So um, I was just remembering this. There was a senior officer's sister who had a severe burn with inhalation injury, so that the whole airway got burned, and she we fought. We tried to operate on her, and we did. But she had 70% burns with inhalation injury, and the artificial skin or the skin graft, we did not have a skin bank then, so this was many years back, and it was flown in from Mumbai, and we had a senior AFMCI. I spoke with him, and he was kind enough to have it sent across, and it came in, and it came in when we were operating, we were finishing the surgery, but since she developed complications, we could not apply the skin grafts, and she unfortunately died. But the skin graft was there, and this was the skin which has been taken from cadavers. That means people who are already dead. So that was processed and ready.
जी.
The next day, as bad luck would have it, we had three tank blast victims,
Okay.
serving soldiers, and they were pretty badly off. One had 65%, the other one had 50%, and the third one had 35% burn wounds. 35% burn wound patient we could operate, and we could get enough of his skin to apply on his wounds. So he was fine. 65% and 50%. So I remember asking the gentleman, and he was a senior officer in the Army Medical Corps, but I asked him, I said, this is your property, so to say, but do I have your permission to apply these grafts? These guys want it desperately because they'll die otherwise.
जी.
And he said, of course, yes, why not? Go ahead. This is for survival and for patients. So we applied those skin grafts from somebody else, from another skin bank. When we did not have a skin bank, we were fighting for it for many, many years. But finally, I'm so glad we have it. And all these tank blast victims survived and walked out of hospital in
Sir,
less than 2 months.
may I just interrupt? I wanted to ask you about, and I'm sure the audience also would be inquisitive, कि ये जो स्किन ग्राफ्ट्स होते हैं, जैसे हम ब्लड की मैचिंग करते हैं, तो एक तो ब्लड हमारा लाइफ पर्सन से ही आता है. ये स्किन ग्राफ्ट्स कहाँ से आते हैं और उसको किस तरीके से मैच करते हैं? डू दे मैच एनीबडी एंड व्हाट इज, वुड यू लाइक टू टेल अस अबाउट इट?
Yes, correct. So, good question again. So basically, the skin grafts are taken from the cadaver. So the patient is dead or brain dead, and then you take out the skin grafts as we would from any other living patient, and then they are processed. Not too much of antigenicity. So any person, we don't do a matching. It is not like a match of a kidney transplant or a liver transplant.
जी.
And no immunosuppressives are also given. Why? Because the patient who is to be applied these skin grafts, remember, will be rejected by the body.
Okay.
Because skin is very highly antigenic. That means it incites a reaction from the body, and which immediately understands or recognizes that the graft of the skin is not of the same body or of the same person,
जी.
right? So it has to be now to so it will act as a good dressing. It will act as a sterile dressing. Hope that the body, because of the barrier function of the skin, which has been lost in the burn area, if there are significant burn areas, then the patient is losing a lot of heat, a lot of fluids. The barrier function is lost to them. Therefore, the infection can crop in, and these patients do die of overwhelming infection.
Infection.
So that infection is prevented by this dressing.
अच्छा.
And since the immunity of the body is low
जी.
in these majorly burnt patients, therefore the rejection is slower. So
Okay.
that means you're giving the body about 2 to 3 weeks for it to fight against this heavy, overwhelming load of infection, trauma, and
सो
it's
इट्स
so
अ
that's
स्टेराइल बैंडेज और फिर नीचे से
dressing.
रीजनरेट
No,
होती है या
dressing. Yeah, correct. It will regenerate to some bit, but
जी.
it definitely acts as a biologic dressing,
जी.
and therefore it will reduce the stress and the load on the body. Some healing will occur. Whatever healing occurs, we can take those grafts or those healed areas again as skin grafts. These will take.
ओके.
These will stick,
जी.
but what has been taken from the other person will not, but it definitely helps, because for example, when I talked about these tank blast victims, 65 and 50% both had inhalation injury,
Oh.
because they were caught in a tank which was closed. They were lucky to survive, but so the injuries were significant, and 65% and 50% both will have lesser amount of available available skin. Therefore, some amount of skin will have to be brought from outside. Earlier, many years back, over 2 decades back, we actually used to take for young children. We
जी.
used to take skin grafts of the mothers
अच्छा.
and apply them on top of because they were closely related, so the genetics was closer and so on, and the rejection of the skin grafts would be slightly so it would be prolonged.
Right, right. So, sir, what are the other cases that you wanted to share with us? The interesting cases that we were talking about. हम उधर चले गए
No,
स्किन उस पे.
the second one is my own hair transplant.
अरे वाह,
So
फैंटास्टिक.
yeah, you saw me as a
सर, आई एम गोना पुट
so
योर पिक आउट हियर. आपको मेरे को पुरानी वाली पिक देनी पड़ेगी.
yes, I will. So this
जी.
is 6,200 grafts, about 12 months or so after the surgery,
जी.
and I've had a haircut, so the hair is not seen too grown too
But it's
long,
looking
but
quite populated. It's good.
yeah, it's nice, and people say that I've lost over a decade in age. So yeah, but this was a completely pain-free experience. There was no other doctor. I was the only one who was monitoring my own surgery, and it was done by my team. Fantastic team that we have. In fact, right now there's another hair transplant going on, so I'll just go and join them. So this is, and I enjoyed every moment of it. It was completely pain-free. I sang Kishore Kumar, Mohammad Rafi songs, even Hotel California, replete with the drum beats and so on. It was amazing,
Sir,
and
this hair looks
another disaster.
darker than the ones on the side. मुझे बताएं
Yeah.
कलर भी चेंज हो जाता है क्या?
No, yeah, no. But another good one. So I was lucky enough to have the donor site, which is here. You see that?
हाँ हाँ.
This was dark.
अच्छा.
This continues to be dark. So the dark hair was replaced with I mean the dark hair came up. So that was fantastic, and this was we make it absolutely safe and painless here at Langar Sculpt at our clinic. The third one which I wanted to share was, which opened my eyes many years back, when this lady actually literally carried her breast. She had such heavy breasts that she was carrying them, so to say, on her arms, and she walked into the clinic, and she said, "I have extra weight on my chest," and being an ex-army man, I knew what that meant. We used to have our knapsacks full of stones and boulders, and run 5 kilometers or 10 kilometers and so on. And at the end of that, we used to just want to throw this knapsack off.
I
And
agree.
imagine this lady has been carrying on, and ladies like her have been carrying on with that extra weight for all their life. So, so when I operated on her, I reduced the breast. I always she told me this tagline, which I tell all my other patients whom I do breast reduction for. She said, "I never felt as light. I feel I'm ready to
Amazing.
fly."
हाँ.
This was in the evening, and when she hugged me, she had tears of joy.
अच्छा, now one
So
subject
there,
that is
he there, um, she showed me that how what we thought was a cosmetic procedure
जी.
has a lot of reconstructive overtones to it, or rarely, because a reconstructive material or perspective is much more, because it causes a lot of back pain, shoulder pain. The brass straps cut into the shoulders. These ladies can, and they have on the undersurface of the breast, because of the trapped perspiration, they develop fungal infections, bacterial infections, and so it was fantastic.
one more topic that's like really close to my heart is for the cancer survivors. What are the
Yeah,
surgeries that you come across, and what are the surgeries that you do, be it reconstructive, be it cosmetic? So, what all can we do for these cancer survivors? How can we help them? Because, see, body image as such is also very important. तो cosmetic issues
yes,
भी होते हैं, and reconstructively भी हम क्या करते हैं sir?
correct. So yeah, these guys, my heart goes out to cancer survivors, and as it is, they're undergoing so many hits to their body, to their mind, to their soul, and they're really absolutely down in the dumps. So when we when there are huge areas of the cheek, or the head and neck, or maybe the bone, the mandible, the lower jaw
Oral
has been
cancer के
removed,
time पे.
oral cancer.
जी.
So we do what is called as a free flap. So where we take bones from the leg, the fibula,
जी.
the outer bone, and flesh from the outer thigh, and so on, and then suture it with artery to artery,
जी.
vein to vein, and possibly even nerve to nerve, with such thin, teeny weeny stitches, which are not seen by the naked eye, and which are thinner than our hair strands.
जी.
So that sort of a thing that can be done. The breast reconstruction can be done with tissue taken from the abdomen, and these ladies will be, as it is, knocked out, down and out. By giving them that opportunity to improve their body image, we definitely work well with their psyche, and definitely help them overcome these troubled times. Cosmetic surgery mainly for scars which show too strongly, and we can actually do the scar divisions, or maybe even laser therapies, and so on, and even for protruding bellies, or abdomen which is lax and falling down, or we had redundant skin, we can do tummy tucks, etc. So a lot of procedures can be done for cancer survivors.
सर, a lot of patients come to you, तो आपके दिमाग में आता होगा ना कि अच्छा, इसने जैसे सपोज न्यूट्रिशन हो गया, या इसने एक्सरसाइज का ध्यान रखा होता, या फिर ये साइकोलॉजिकली कुछ एक्सपेक्टेशंस होती हैं. व्हाट इज़ इट दैट यू फील कि आप कई बार शायद पेशेंट्स को सीधा नहीं बोल पाते, बट हियर ऑन द शो यू हैव एन अपॉर्चुनिटी टू टेल पीपल इन जनरल कि had you taken care of these things, had you come to me like this, or these were the situations you could have come to me. So what are those takeaways कि अच्छा थोड़ा पहले आ जाते, यू नो स्टफ लाइक दिस, हम एज डॉक्टर्स हम सबके दिमाग में आती हैं. सो व्हाट आर दोज
Correct.
थिंग्स दैट यू वुड लाइक टू टॉक टू द पब्लिक एज अ प्लास्टिक सर्जन कि ये इस तरीके से डू दिस.
Yeah. So, as you said, a lot of this I do tell my patients because they take it from me because of the great temples and the ex-army tag. But you're right. I mean, the takeaways are that you must have a healthy lifestyle, exercise, well, if you go for plastic surgery or especially cosmetic surgery, have a realistic expectation. By all means, your dream will be fulfilled,
जी.
but always have a realistic expectation. And a lot of patients today, unfortunately, because of Dr. Google, so to say, have become doctors themselves,
True.
and they would much rather uh, get themselves operated by Dr. Google in the confines of their room
So
and their
true.
home, rather than come on a formal, live, man to man consultation with a plastic surgeon. They would want to know the starting point is the cost factor, and nobody talks about the quality of treatment to be given. Yet everybody expects numero uno, number one treatment in the world. So that's sort of a thing. A lot of us, a lot of especially the kids, are not looking after their hydration.
Okay.
So I would love them to be hydrated. A lot of patients of mine tell me, "I want a glowing skin like yours." I said that for that you have to be happy from within and stay well hydrated.
जी.
And of course, a couple of procedures here and there, but that's okay. That's fine. It helps, and it definitely helps boost the self-esteem and the body image. The another takeaway is an equally important subset of patients who have body dysmorphic disorder, especially now with increasing pressures of generated by social media. Small blemishes here and there, asymmetries here and there show up on the screen, and you want them corrected. It's okay. It's great if you see that, but to get obsessed with such small blemishes which are not seen by others is actually taking it too far. So we try to dissuade these patients from procedures, surgical and even otherwise. And the last but not the least, reduce your screen time.
Okay.
So we have a lot of dark circles, a tired look, a lot of facial deformities coming up with increased screen time from all devices. So that should be considerably reduced.
Thank you so much, sir. I think you're one of the most genuine and most amazing plastic surgeon I have come across. क्योंकि आज से 5 साल पहले मैंने आपको फ़ोन किया था और मैंने आपको बोला था सर मेरे फेस पे क्या करना है, बट विद द प्योरिटी विद विच यू से कि तेरे को लगता है कुछ कि कुछ करना है तो सोचेंगे, अदरवाइज योर फेस इज जस्ट परफेक्ट. एंड द वे यू टेल चिल्ड्रन, द टीनेजर्स हु गेट सो obsessed with plastic surgery कि हम तो पता नहीं किस तरीके से दिखेंगे खुदा एंड सेलिब्रिटी टाइप. And I love the humility and the pure nature with which you tell them कि नहीं कराना. In spite of being a plastic surgeon, you can always tell them कि मैं करा सकते हैं. Thank you so much for being so open, sharing your experience. Thank you so much for being with us today. Thank you so much, sir.
Thank you. Thanks so much, Namita, for having me over and this show. I really enjoyed the whole question answer stuff, and your questions were so incisive and so fantastic. I mean, it was loads of fun to be here on your show. Thank you very much
Thank you
for
so
having me.
much, sir. And
Thank you.
dear audience, I'm sure you must have enjoyed the show, and you should now like, share, and subscribe the Army Doc, because this is the place where you will get the authentic medical information. Keep watching and keep enjoying. Namaskar.